One question that people ask me is, what's the difference between Invisalign and the online-based retailers? So the big difference is with Invisalign, it's globally the biggest aligner out there. It's been around for many years. They have a lot of data, which is very crucial on how teeth move, and they've improved their technology year on year. So it's patented technology, and it's advancing very, very well. So the ones which are online, number one, you don't have a consultation with a dentist. Now that's quite crucial because it's not just about aligning teeth. You have to look at the underlying issues. A lot of patients also have underlying gum disease. Now, if that's not addressed and aligners are given, then that's a disaster, because you're only going to accelerate that. And unfortunately, I've had a few patients come in with this problem, and it's not been good. So one of the things I would say is definitely think about having a consultation, so all the underlying structures are checked: the condition of the teeth, the condition of the gums, before you embark on an online aligner program. The other thing that's quite crucial, which again is not addressed, is moving teeth gives you a different bite, and that bite has to be calibrated at the end of your treatment. Otherwise, you're going to get issues such as TMJ issues, which is joint pain, as well as headaches and such things. So having a correct bite at the end of the process is quite crucial. So making sure you're able to do this and calibrate teeth is quite important in certain cases. So the other thing is taking impressions. These have to be very, very accurately done. So any system where they ask you to take your impressions at home are, in my opinion, ridiculous, because the quality of those impressions have to be very, very good in order to give you an accurate aligner and therefore an accurate treatment. So that's what I would say about that. Other issues commonly that occur during aligner treatment is black triangles, which is a concept where in between the teeth, you have a triangle where light can get through. It doesn't look very nice. That happens quite a bit with any type of orthodontic treatment. And this is something you need to be warned about. And at the end of the treatment, you're going to need to seek some restorative work to actually fix it. So commonly, bonding is considered, or ceramics in certain cases. Again, these are things that would only be able to be done at a dental practice, not something you can do online based. So other questions? Yes. So this is something that I've heard about, but I'm a bit shocked and don't really understand it. Is some people are advocating, or some brands are advocating, that you can wear aligners just at night. Now, I do not understand how that could work. So my feeling on it is that it's very gimmicky, and it's just trying to satisfy certain people who do not want to wear aligners all the time, so it gives them an option just to wear them at night. But in my opinion, that's just not going to work. You take 2 steps forwards and then 2 steps backwards by only wearing them at night, because teeth are moving all the time. The way that Invisalign works is it's a pressure-based system. So by wearing it all the time, it's putting pressure on the teeth to move them. As soon as you take the aligner out, it rebounds. So one of the most important aspects of aligner treatment, or indeed any orthodontic treatment, is retainers. Retainers is crucial. If you don't have retainers, your teeth are going to move back. So what do we recommend? Well, where possible, a fixed retainer, which is a little wire on the inside, no one can see it. You get used to it, you can't really feel it after a while. And then having a removable retainer to wear at night. So Invisalign have their own removable retainer, which is the Vivera retainers, and they are very, very good. So I would highly recommend those, as well as a fixed retainer. And if you don't have this, then in my opinion, your teeth are going to move more than you would like over years. So we normally do both, just to give that extra protection for movements. So any sort of system that you consider, retainers has to be mandatory at the end of it, otherwise it's just not going to stay where you want it to stay. Ortho with retainers should really be done by a dentist with either a scanner or an impression. It just has to be very accurate because it needs to be really tight fitting. And that's quite crucial. So again, any system where it asks you to take a measurement at home is just not satisfactory. It needs to be done by a professional, or it needs to be a scan, which is very accurate. I hope this has been helpful. I've answered quite a few of the most common questions in relation to Invisalign and aligner treatment. If you have any further questions, please just contact us on our website. We are offering video consultations, which is very useful now, and we're able to give a fairly good indication as to what treatment is necessary for someone before they come in for a consultation. So that's something that you can find on our website, along with the SmileView app, which is from Invisalign. Again, that's really useful. And by all means, just contact our team and we'll be very happy to assist you. Thank you.